Okay, so for my first therapeutic agent, I'm gonna do ice bag. So I went to the ice machine, I filled it up about halfway. So with this one, what I'm gonna do is with the ice bag, it's gonna be placed directly on the knee. And then I'm gonna put a wrap around it first. I will get the air out of it to make sure that the ice is tightly secure on the bag, so there's no mushing around. I do this, and then with icing, this helps, with pain relief, reducing inflammation, and then it can reduce some spasticity. We typically do this for around 20 minutes. So with this, I'm just gonna place it directly over her knee, like this. But first, what I would look for is any type of, just looking at the knee, making sure there's no open wounds. Her tolerance to cold, I would ask about that. I would say you're gonna feel the sensation of coldness, burning, aching, and then some numbness will be the last thing you feel. If you cannot tolerate that and it feel like it's getting too cold, just let me know. But I'm just gonna place it directly over the knee. Like I said, looking at skin integrity, all that stuff, if there's an open wound or something like that, I would not do this, but everything looks good here. So I would place it on the knee like this, and then with that, I can use a little wrap, kind of just wrap it right up there. And I would just get it nice and secure with a wrap. Obviously, I don't have that material here. And then what also to just, increase that blood flow, what we can do for people is we can just elevate that leg. So lift here, here, and then we would have it wrapped there, and then you would have that for about 20 minutes. And then with that, just making sure the whole time, if they feel like I said, that tolerance is not there and need to take it off, we can take it off. But then after we're done, taking it off and just looking at the coloration here, if there is anything going on that we needed to look into further, but everything looks good there. So with that, that's the ice bag. Okay, so for this next one, we're gonna do the ice massage. So usually you'd have a cup. I just have a little ice cube here, but you'd usually have a cup, and then it would be frozen in a freezer, and then you tear off the top, so it'd just be exposed of the ice on the top. So you'd hold it with the cup, and then there'd be ice exposed, and then you put it around a certain area. So what we would do here is first screen for anything in here. So this is also, for pain relief, reduce that inflammation, and then it can decrease spasticity. So I could do this on like her lateral elbow here. So with this, making sure I look and seeing, okay, there's no open wound, everything looks good there. Her tolerance for coldness, she said, was fine. She doesn't have hypertension. It's not going over a major nerve. So with this one, I would just do it in that general area, and I just do small circles in that area. So just circling around here. And then I do that for about 5 to 10 minutes, knowing that, and then telling her that, hey, you might feel that cold sensation, the burning sensation, aching, and then you'll go to that numbness. And then we'll stop the treatment, usually stopping the treatment when she feels any type of analgesia. And with this, we do it for 5 to 10 minutes. Boom, making sure afterwards skin looks okay. There's no after effects other than maybe that numbness. It looks good here, and then we would just dispose of the ice cup afterwards, and then put the cup back in the freezer for the next use. Okay, for my last therapeutic agent, I'm going to do the hot pack. So hot pack, the book is going to be the hot pack. We're going to put it on the low back here. So it's okay if I lift up the shirt. So this can be applied directly onto the skin. But looking at precautions first, just asking if there's any recent maybe hemorrhages, if there's bleeding in that area that's been recent. areas of that, maybe acute inflammation, maybe an infection in that area, or let's say if it was a female, maybe pregnancy would not be good, but as I can tell from this area, it doesn't look like that. Any recent history of bleeding?
No.
No history of bleeding. Okay, so with that, covering those precautions. So with this, the hot pack, you'd want to put it to the size. So if it's going on the full back, it'd be a little bit bigger than this, but for this example, we're going to use that. And so what you want is you want 6 to 8 layers in between the hot pack and the patient's skin. So each layer, so I have 3 towels here, so this would be kind of 1 layer here with that. Then we could add a second layer here. So that would be 4, so each layer counts as 2, and then we'll go 1 more here, which is 6. So we have 6 layers in between the hot pack. We then place it directly on the skin here in that position. So if it's the low back, we'd have it sitting there, just making sure throughout the time she feels comfortable. She doesn't feel that burning sensation too much. Obviously that heat, you want to decrease that pain, decrease the swelling or stiffness, and then increasing that tissue extensibility. So with this, you'd be on there for 20 minutes, but just constantly asking, when you're around, hey, do you feel okay? It doesn't feel like it's burning you at all. It's not hurting. So then with that, you then take it off after 20 minutes and just kind of look at that area. Obviously, there may be a little bit of redness there, but as long as it doesn't look like there's any burning, burn marks that are on there or anything extensive that maybe we have to take a little bit more of a look at. So it might be a little bit of redness, but at the end of the day, if there's no serious issue there, then it should be fine. So like I said, again, 20 minutes there, then taking it off and putting that hot pack back in where it was originally at before.